Hi everyone. Today I'm going to be talking about dissociative identity disorder, often just called DID. People with DID have almost always, if not always, undergone horrific trauma, usually before the age of 6. We see this a lot more in females than males because the trauma is very likely to be repeated sexual abuse. This pattern of trauma causes the person to compartmentalize their memories, creating alters or separate identities. Here's some basic terminology that you need to know to understand DID. First is the host, which is essentially the main character. This is who you might think of as the true person, who they are at their core, who is controlling them and at the forefront the most often. Fronting describes when an alter takes control or the host takes back control of the behavior and consciousness. Alters are the different identities. A system is all of the alters and the host together. A system is the human, all of them, every identity that is included in this body, they all have to live and work together. The gatekeeper has access to the traumatic memories or at least knows where they are in a more complicated system. They have complete control over who fronts and allows when some alters can receive some information. Protectors are exactly what they sound like, kind of the fight in fight or flight, and this can be verbal or physical. Fragments are not really a full personality or identity. This is sometimes where a single memory is stored, or there's part of a personality that isn't really differentiated from another alter. Persecutors, we need to be on the lookout for because these are the alters that engage in self-harm and suicidal behavior to cope with the trauma. So a lot of people may be concerned that they can somewhat relate to the dissociation that is being described, but it's really important to remember that dissociation is on a spectrum. If you zone out while driving down a straight road, but you're able to drive safely, there's no cause for concern, just as an example. This is more like feeling that life isn't real or you aren't real, that level of stuff. And with dissociation, there are a lot of different mental health disorders. So if you relate to that, that doesn't mean you have DID. This is for informational purposes only. If you think you have DID, please talk to a mental health professional. I have here some external signs if you think someone you know has DID, and some internal signs if you think that you might have DID. Most of the time when people with DID encounter mental health professionals, it is in like a crisis situation, like suicide. So immediate safety needs and stabilization is the most important thing, and it may be months before you can move to any of these other steps. It's important that folks with DID be treated by someone with training specifically in DID. The media overall represents DID in a very negative light, and that's just not accurate. People with DID are not more dangerous to others than anyone else necessarily. They certainly can be to themselves, though. I love Encina Severa's YouTube channel. She shows up very openly and even records some of her alters fronting, which is super helpful to have that representation. She even did an interview with MedCircle that's really good. The Many Sides of Jane is also so good. The documentary follows Jane through 2 breakups, and it shows how hard it is being a single mom because having DID is so time-consuming, and it can cause her a lot of issues in just doing everyday tasks. So here are my references, and thank you so much for watching. I hope you enjoyed this video. Please like and subscribe if you would like more information like this.